So moving to treatment options, if pancreatic cancer recurs, these will include chemotherapy-based treatments, similar to what we've discussed previously, and it might depend what an individual got after their original surgery. So for example, if a patient received gemcitabine treatment in the postoperative or adjuvant setting, then we would typically switch to a 5-FU based program such as FOLFIRINOX or 5-FU and nanoliposomal irinotecan as a subsequent choice. And here I'll go back to this genetic context that we discussed, looking for actionable targets, and these can be in the tumor, so looking at the genetic makeup of the tumor itself. And there are a variety of rare but important findings that we can pick up, for which there are drugs available either in an off-label, so outside of a clinical trial context, or in the context of a clinical trial that could be considered. And I would say an important other, it's again infrequent, but very important when we find that for that individual and their family, we'll look for something called MSI high, or microsatellite instability, also called mismatch repair deficiency. And this is when there are a number of genetic changes that lead to a lot of mutations in the tumor. And the importance and significance here is twofold, that can be a hint that there could be a genetic underpinning in that family, so we want to look for that, but also for the individual who's affected by the disease themselves, that individual may benefit from an immune therapy approach, which doesn't have an everyday application for this disease, but for that couple of percent of people, it's a very important thing for us to identify. And of course, the whole consideration of clinical trials.